again, layman's terms, not just bad. This is like, man, we are really having to involve the police, the principal, and the like. So because they're bullying, they're threatening. This is the person who is aggressive to animals or to people. They're stealing. They're violating the rules in some way. This is about 6% of the pediatric population. And again, destroying property. Once you get to 18 years old, I personally find this a little bit arbitrary, but once we get to 18 years old, we no longer will call it conduct disorder. We have to start looking into what is the personality construct of this person. And we likely, assuming they have the same symptoms that made them fit the criteria for conduct disorder, we're now calling it antisocial personality disorder. And again, antisocial in this sense is different than when we say like, oh, he or she is antisocial. In social layperson's terms, we mean they don't want to hang out with people. They don't like people. In this way, we mean someone who is on a path that will likely include some type of authoritative intervention. So whether that's the police, the hospital, some type of guardianship, those kinds of things. And then when we also were diagnosing children with conduct disorder, we have to determine the severity. Severity in this sense isn't about how many settings, it's about how many symptoms they have. And then also we want to determine, when did it start? Was it teenage years or prior to that? The difference with conduct disorder than many of the diagnoses we have in the DSM-5 are that the distress that the person feels is directed outward, right? So we think of a classic one is like anxiety. A person has an unnatural fear of things, and it's very much internalized. I don't want to be around people. I think people are talking about me. I'm getting worked up and I'm starting to have a panic attack. It's all internally focused. Those who are at risk for conduct disorder are children who have experienced abuse, any type of abuse, who has a parent that is using substances, or harsh parenting. And I'm throwing this in here because I get asked this a lot. I know the state of Texas rules, so I'm gonna quote those. State of Texas says that you can use corporal punishment. Corporal punishment is spanking. You just cannot leave a mark. If any mark is left, it's considered abuse. So when we talk about harsh parenting, we're talking about this unnecessary use of either corporal punishment or almost on the edge of verbal abuse. There have been plenty of studies that come out that kids who hit come from families that hit. And to be kind of funny and a pun on words, it's that kind of hits hard if you think about if you are spanking or popping or tapping or whatever you call that in your home, to consider that your child will probably go on to spank their kids. And you can decide if that's good or not. But I like to put that out there because a lot of people don't consider that. And conduct disorder is obviously to the extreme of that. So now I want to talk about comorbidities. Comorbidities are those things that occur alongside oppositional defiant disorder, as well as conduct disorder. So this is a busy slide, but I want to talk about this a little bit slower than the slide suggests. When I see someone who's coming in, and a lot of times, today I worked a full day, I'll hear from parents, he or she doesn't listen. They act bad. Every time I ask them something, they don't do it. I have to look into what else is going on. Is this a child that didn't hear you from the beginning because they're easily distracted? And so they're not listening, and their poor behaviors are really a part of an inattentive or hyperactive type of complex. Someone who has a mood disorder is going to struggle with their behaviors. Now, whether that's being irritable and angry, because that's oftentimes how depression presents in teenagers and kids can often be misconstrued for they're bad or they're being defiant or they're talking back. But once you start to peel back those layers, you realize, no, something else is going on. One of the big things that I want to bring up is trauma, right? So anyone who suffered verbal, physical, sexual trauma, and then traumas that we may not even really think of. So indirect trauma. So things like divorce, things like switching to virtual school can really have a lasting impact on a child's behavior, and that we have to consider those as well. The other thing is to consider is substance abuse. You know, if there's any use of any drugs, alcohol, tobacco, or even vaping, which well, out here with kids is pretty big, you have to consider how is that affecting their behaviors during the day. And I know that there are a lot of questions about this, so we'll get to this piece. Again, what are the treatment options? There are no, I want to repeat this, there are no FDA approved medications for oppositional defiant disorder or conduct disorder. So when people come into my office and they're like, well, what can we do? What medication can we give them? And I'm like, I don't really know. I got nothing for that particular disorder, but there are other things that we can do. So for our ODD, we're talking about therapy. Depends on how old the child is, but parent management training or parent-child interaction therapy. So for those who are familiar, PMT or PCIT or CBT for an older child. Also, social skills training can be really, really helpful. But I still get asked all the time, what about medication? Because this is bothersome and I don't want this to keep going on. I need for my child to improve. Again, we think of what are the comorbidities? Is there something else going on? And I forgot to put on the comorbidities, learning disorders. A child with a learning disorder is going to struggle with their behavior when asked to learn and to pay attention when they don't have the wherewithal to do so. The treatment for conduct disorder is therapy. You know, for anyone who's taking an exam, the answer is always MST, multisystemic therapy. And what that is that's home-based. You'll see this a lot in the juvenile justice system. It's home-based, and it's someone who's a lead on the team working with the family members to understand what's going on with the adolescent, to help them to establish boundaries and to provide positive parenting experiences. Family-focused therapy is a little bit different. It's helping the family to understand the origin of what's going on with the adolescent or the child. Group therapy can be helpful as well. But I get asked about medications. A lot of times when medications are being prescribed for ODD or for conduct disorder, they're using a different diagnosis. There's something else going on. So a lot of times, so I guess I also see kids from the Juvenile Justice Center. There's usually a mood component to it or a substance use component. And so then you would be using medication to treat that part. It wouldn't be direct treatment of CD, of conduct disorder, or oppositional defiant disorder, but treating these other things that are worsening the behaviors we see or the symptoms we see with ODD and CD. And so I've come to the end of my part of this. I'm on Instagram, my personal, my work email, as well as where I work. I'm always available for questions. I will say that if you ask me a personal question, because I'm not the treater and I'm not licensed in the state of Georgia, I will answer generally, but I will answer. Thank you, ladies.
Thank you very much, Dr. Rector. And now I'm going to turn it over to Dr. Natasha Demond.
Thank you. Great job, Dr. Rector. Let me see if I can share my screen. Okay, I'm guessing you guys can see my screen, right? Am I good to go? Okay.
Yes. You are good to go.
Okay, good. Okay, so go ahead and start here. So good evening, and thank you for allowing me the time to discuss some items that may help manage the virtual space. So I'm more so coming from the school psychologist perspective on, when it comes to dealing with conduct disorder and oppositional defiant disorder. So again, I'm going to provide you all with some school-based implications in the virtual setting that you may be able to transition into the home environment and vice versa. So just a little background. My passion is to provide parents the tools to be advocates for their own child, right? I'm a mother of a 14-year-old. This is my son, Darius. And my son has always had a history of mild attention difficulty, especially during his early childhood years. He was always an AB student. However, after his accident, he had a near drowning accident back in 2013. I noticed a significant decline in his performance, and I saw it in his grades. I saw it in his executive functioning, and this is including, him completing assignments, him being able to pay attention in class, just planning and organizing, things like that. I noticed that it was severe. So I definitely can say that the accident that he had back in 2013 exacerbated those symptoms of attention difficulty. So even though I was in a space that, even though I had these extensive background in training and working experience in providing psychological services in schools, I was challenged in advocating for my son as his mother. So therefore, I do come from a place of understanding from a parent perspective when advocating. So as a school psychologist, we provide direct support and interventions to students. We consult with teachers and families and other school employed mental health professionals like the social worker and the counselor. We work with the school administrators to ensure or to improve school-wide practices and policies. And we also collaborate with community providers to coordinate needed services. So now that we are in these difficult times, it is definitely essential for us to establish ourselves in as a mental health and behavioral health service provider, even more than ever. Because we have a very unique training and skills that is designed to provide and to evaluate cognitive and emotional behavioral functioning. It is not only our skill set as mental health professionals that make us so unique and useful in this area, but it's also our comprehensive skill set and our ability to practice a broad-based role. It is our knowledge of data, our knowledge of curriculum and instruction, but also our knowledge of child development and diversity. So we pretty much bring all these skill sets together to make us very invaluable providers of these services and the school. So how do you contact a school psychologist? Well, every school has access to a school psychologist. We may serve 2 or more schools, so we may not be at that particular school every day. But because I know for myself, I have about 4 schools right now that I service. One is a KIP, so I was kind of happy when I saw Dr. Rector, she served a KIP school. So one is a KIP school. So I would just say contact the school directly and say that you want to be in contact with the school psychologist. I get emails all the time, and we're pretty much proficient in responding to parent requests and things like that. Now, given that we are in this pandemic and all the uncertainty of things, the level of stress has definitely increased. I know definitely for myself, since COVID has started, I have personally developed some anxiety and stress. So imagine if we are struggling as adults, just imagine what our children are going through today. So overall, the needs are great right now. Now that we are 9 months in, I can't believe I'm saying 9, but it's 9 months in. So many factors may impact students and families in the virtual setting. Of course, again, family stress is an all-time high right now. Fear and anxiety, the uncertainty. Again, there isn't a mental health professional or trusted adult where we can say, where we have our eyes on our babies and say, you know what, I've been there before, and this what seems to help. You know, we're not able to see our children face to face like that. Children and families, they're dealing with grief and loss of a loved one because of the illness, loss of even the significant interpersonal experiences, being able to play with your friends, being able to celebrate, going to prom, you know, moving from elementary school to middle school or middle school to high school. You don't have that that ability to do that. So we're definitely missing out on that. But more importantly is the behavioral management issues. Daily rebalancing of student behavior while at school is absent since kids are at home. We don't have that ability to help with the rebalancing of that. And it does take a lot of skill, patience to manage at home without the support. So it takes a team of people who have experiences and training on how to educate children to provide those type of services. So I can only imagine having parents having to navigate through all that. It can definitely be stressful and overwhelming because I can attest to that with my middle school son. So with that said, it is essential for us to be aware of what kind of support is provided at your school base, at your school level, to help alleviate some of those stressors. So who can you contact at your school, right? So as a parent, I know that there's nothing more frustrating than not knowing who to contact at your school, maybe getting bounced around by phone or email when trying to seek an answer to your question, especially now that the child is home more often. Is like you're seeing more of what the day goes, how the child is functioning throughout that day, versus a teacher is telling you what they're seeing in the schoolhouse. So I know I can definitely understand that. So I can't really speak for every school system. However, there is a list of titles of staff that may be used at your respective school or school system. So one of which, you know, the first point of contact definitely is your classroom teacher. Definitely voice your concerns with that. If you see that there's nothing is progressing, or if you're still seeing problems, or you know there's still a concern there, definitely there is a multi-tier system of support, and I will definitely go through this in the next slide, where you will have your individuals like your intervention specialists that's there, your 504 plan, your 504 person that takes over that. Also your counselor, your school-based specialist. And if your child is receiving special ed services, you do have a contact with your special education lead teacher. So do not feel shy, or do not, you know, that's what we're here for. We are here to make things a little bit more easier, or just to help with the process, because we all are going through this learning process right now. So what is a multi-tier system of support? So even in the virtual school setting, school systems are still responsible for federal process to the best extent possible. One of these process is to support students is the multi-tier system of support, which is MTSS. And MTSS is a data-driven prevention framework that uses assessments to identify and to predict students who may be at risk of poor learning outcomes. Maybe it's emotional, behavioral issues, social skills that may be impacting their learning. So this is all that is there to support you through the school base, but we are all are trying to make sure that you are receiving support virtually as well. So this is also including your positive behavioral intervention support, which is your PBIS, your response to intervention, which is your RTI, and that is how by us putting interventions in place, how is the child responding to those interventions, right? So it's constant monitoring of that child's behavior and academic as well. You also have your student support team, which is a team that I'm constantly on. And again, we talk about those RTI, we talk about what the concern is, what type of research-based interventions we're putting in place, and how are we constantly monitoring it. And the beautiful thing about SST and RTI is that it forces us to come back within maybe 4 weeks or 5 weeks to look at that data to see what next step we need to take. Not every, there's not a cookie cutter, interventions for every child. So sometimes it's a lot of trial and error when it comes to things like that. Certain districts have student mental health services, and also our wraparound services, and I'll go through that down the line. So again, you have your RTI coordinator, you have your SST chair. So definitely, if you're seeing concerns at home, talk to those individuals in the schoolhouse, and I will definitely mention specifically with that. So you also have your Section 504. And Section 504 of Rehabilitation Act of 1973 is one of several federal and state laws that protect students with disabilities. So Section 504 is a federal Civil Rights Act statute prohibiting discrimination on the basis of the disability in any program or any activity receiving federal funds. So what does this mean? So when, if you have a child that has sickle cell, for example, that a health condition such as sickle cell, where that child may be out of school for an extended amount of time due to flare-ups, they still need to have access to the general curriculum. So therefore they may need a teacher to come to the hospital to make sure that they are still receiving that instruction. What about a child that has asthma? Sometimes they may need to have the inhalers on them throughout the day in case of flare-ups or things like that. So that will be protected under Section 504. But it also protects students who have those DSM-5 diagnoses that Dr. Rector mentioned, like the anxiety, like the ADHD, like the oppositional defiant disorder, and the conduct disorder, things like that. So where we are entitled to provide behavioral accommodations, such as it may look like giving extra time to complete tasks. Maybe they need extra time to complete tests and quizzes. And tests and quizzes is not just in the classroom, but it's also in the standardized assessment, right? If we see that they need preferential seating, so just making sure that the child is sitting in the front of the classroom or near the teacher's desk and not near the window where they can easily be distracted because the birds are chirping, things like that. Or they may need chunking of assignments or directions, especially with those ADHD students and oppositional defiant disorders. Maybe they need, instead of doing a whole sheet of paper of 20 questions, maybe they just need to chunking it up. Instead of doing 20, they go ahead and just do just the first 3. And then you come back to me and let's go through it. And then, you know what? Okay, great job. Go ahead and do the next 3. So therefore they feel a sense of accomplishment, because any child, especially anxiety, if they see all that work on that one sheet of paper, they are going to have a meltdown and it's going to stress them out. So maybe that will help. And so again, this is very particular to that specific child and what they need. Just because one ADHD student needs this doesn't mean it's going to be the same for the next child. We have to look at the child individually. And so now we go into special education. And so this is a little bit more intensified, a little bit more individualized to that student. It's still a legal document. So whatever the team decide, that is what needs to happen. And so when I think about special education and 504, 504 affords the child to level out the playing field. You know, you give the child this, you give the child that, so that it levels out the playing field. Whereas special education, I think of it as a child with like Swiss cheese, and then there's holes in the Swiss cheese. And so what can we do to make this child whole, right? So they may be missing fundamental skills that is preventing them to read, like reading comprehension, or their social skills, or their attention and things like that. And it has to be directly impacting their academics. So we have to see a direct correlation. Just because you have ADHD doesn't mean you need special education. Maybe you just need extra time on your test. Maybe that's just what it is. But for other students, we can definitely see that, you know, the ADHD, the conduct disorder, the oppositional defiant disorder is directly impacting the child academically. So if you see that your child is not performing on grade level and they're missing those fundamental skills like phonics, when your child is in 3rd grade and they cannot sound a word, that is a problem. And so that is something where you need to have your red flag on and contact the teacher if they have not done that for you as well, and just voice your concerns so that we can go ahead and at least monitor the child, put some interventions in place and see if that is working. Because it may be that once we put the interventions in place, we can see progress. I know there's a lot of information, so I kind of want to say, does anyone have any questions? But I know that that's for a certain time. As far as intervention and support, in terms of school-based support, of course, we have our school counselors. We have our social workers. People don't think that we have social workers, but we definitely do. And they're so grateful and helpful because they do provide mental health support. They do crisis interventions, maybe individual and group counseling, brief counseling as well. So definitely utilize your the staff that is in-house. Now, now as far as wraparound services, some district may connect individuals with an established set of support that is intended to close a gap that's preventing the child to be successful. So this may look like your anger management, your family counseling, your mental health, services, mentorship. Just and it's not limited to that. There's so many other wraparound services that you are afforded to. Now, when it comes to mental health service providers, some districts have contracted with outside vendors to provide mental health services to students and families for additional therapeutic support. So again, there is so many resources in the school, and there are so many affiliations that we have with other outside vendors that can definitely help you out, not just in the schoolhouse, but also in the virtual setting as well, and provide those type of recommendations specific to your child. Now, but what can you do as parents and caregivers? As a parent who has a child who has some attention difficulty, I know the toll this virtual environment can take on both parents and students. So I have listed a few recommendations from our National Association of School Psychologists. Although all of them I think is really important because many of them I have recommended to my teachers or to my parents. I'm just going to highlight a couple of them because of time, because I can really talk, for a good hour about all of these things. So when you're dealing with a child that has anxiety, I would definitely suggest explicitly teaching your child how to engage in flexible thinking. So if you see that your child is very anxious, maybe involves developing a list of possible solutions to problems and discuss the pros and cons to each possible solution. So helping them understand with that problem solving on their own, especially with our kids that are in middle and high school, they're going to have to learn how to self-manage their anxiety and how to talk through talk through those difficult times. And so the next one I have is model adaptive ways of coping with anxiety. So it's definitely important to know that children learn how we respond by observing behaviors of adults and adults around them. So try to maintain a calm and neutral demeanor during stressful situations. Talk about strategies you use. Maybe the self-talk may be helpful, maybe problem-solving approaches that you use as an adult. Definitely maybe relaxation techniques to help you tolerate any anxiety or stress that may come. So definitely have that conversation with your child. When you have a child that has behavior issues, especially a child that has oppositional defiant disorder or chronic disorder, so this is special because children with behavioral problems often experience hidden benefits for their behavior that seems illogical, unpleasant, maybe even hostile towards others. So if they see that your expression, that you're angry, it stimulates them. It makes them happy when they push your buttons. They find it very rewarding. So I definitely would say when you have those type of situations, definitely practice your own relaxation strategies to reduce your feelings of anger and frustration, because again, they find that very exciting that you're angry and upset. Another thing, and I'll kind of both of those things kind of tie into one another. Establish specific rules and expectations, and focus on what you want your child to do versus not to do. So when I say establish specific rules and expectations, definitely have that conversation with you and your family on your rules and expectations in the household. Maybe even have additional targeted behavior that you want that particular child to comply with. And when they are doing these things, or when they do comply, make sure you give acknowledgement. Make sure you say, you know what, thank you, Jim, for putting your dishes away quietly. So when you acknowledge the positive behavior that you want to see, they will kind of process it like, okay, she likes that. She likes that I did that. So let me make sure, okay, maybe make sure I do that the next time so I get that verbal praise as well. Because as adults, as human beings, we want positive praises from people. From children all the way to adults, we like to get that acknowledgement. So that will be very helpful. Focus on what you want your child to do rather than not to do. So example, instead of saying, don't leave all your toys all over the floor. Instead, be very specific to say, you know what, put your toys away on the shelf. So we want to be very specific as to what behavior we want the child to perform, or what we want to see. So that, because if you say don't do this, don't do that, then it's kind of like, okay, then what do you want me to do? Like, they'll get frustrated, you get frustrated, and then nothing works. So it's just good to be very specific as to what behavior you want to see. Next, establish and follow through with consequences. So again, this can be a household conversation with you and your child, or the other kids in the home, on what you want to see in the home. So earning privileges is a very helpful way in increasing your child motivation. So when you're doing this, make sure you think about what you want your child, or what your child likes to do every day. So personally, I know my son loves screen time. He loves gaming on his PC all day, right? And so I use that to my advantage, because I can get him to clean his room. I can get him to do his chores. I can even get him to take a shower. I hope he doesn't see this, but I can get him to do anything that I want to do if I use the screen time over his head. So again, reinforcers do not need to be materialistic, and it does not need to be a special privilege. But overall, it can be an overall system where this can be a huge prize at the end of the month. But definitely give those, reinforcers throughout the week, so that they have something to work towards. So last two things, set experiences up so that you are doing more praising than punishing, and also catching your child doing good. So these kind of go hand in hand with one another, because people respond best when they experience more frequent praises and positive reinforcement for things that they should be doing, rather than being punished for undesirable behaviors. So it's very good to give your child praises for following the rules. Say, hey, I appreciate you following the rules, or I appreciate you, working so quietly and just giving mommy some really good quiet time. So definitely praise, even if it's something very small that you think that it may not, like, is nothing, but the child is taking it all in. So definitely take advantage of that. So my last slide, these are websites that I have found from the National Association of School Psychologists for specifically for anxiety and conduct disorder, that might be helpful in dealing with those things at home. And that is it. Thank you so much. This is my contact information. So if you have any questions or concerns, definitely reach out to me. I may be able to give a general, and steer you towards the right direction, but definitely feel free to reach out to me if anything. Thank you so much.
Thank you so much, Dr. Damon. Thank you so much, Dr. Rector. Now we're going to jump right into our question and answer portion. I'm going to go with our first question that we have listed in the Q&A function. This is for Dr. Rector. Can mood disorders be misdiagnosed as ADHD?
Yes, absolutely. So to be clear, under mood disorders, we're talking about major depressive disorder, disruptive mood dysregulation disorder, which is a newer diagnosis, bipolar disorder, bipolar type 1, bipolar type 2. And so it can definitely be misdiagnosed as ADHD. Kind of more general, it was very hard for me not to include ADHD in today's talk, because again, I think of it kind of a spectrum of ADHD, ODD, CD with worsening behaviors. And so to me, that comes with a thorough evaluation. So that takes time. That's not something you're going to do in 20 minutes, but asking about, when did these behaviors start? How are they exacerbated? What makes them better? I think, and then also what setting does it occur in, will help you to delineate, is this an attention problem, or is this poor concentration in the setting of mood problems? So in short, yes.
Thank you so much, Dr. Rector. Our second question, now this can be to either of you. I'm not sure of your experience with this, but has anyone taken a look into the effects of diet, increased exercise, and the effects of vitamin D as it relates to, I'm assuming this is regarding improved behaviors. Is there any validity to looking into any adjustments in these areas?
I know I said we would switch on and off. Do you want to take it, or you want me to take it?
I will do my very best, but if you feel like you need to add on, I'm here, sis. I don't have a wealth of knowledge when it comes to diet, but I know that that is definitely a question that we ask, especially with our children who has autism and things like that. We ask about, just what are they eating, about the sugar and things like that. But definitely those who have that attention deficit, that anxiety, or the conduct disorders and things like that, it would never hurt to do some, physical activity, get some sun. We can always use some sun. It kind of, helps with our energy and being productive and things like that. I know every time I get, especially during the summer, during quarantine, I had to push my son out the house, just go outside. So I would say that it definitely would not help. I'm all for the natural side of things and getting the vitamin D's and the physical exercise and things like that. And I think there is a huge correlation between the two.
So I wanted to add, because I get asked this a lot about diet, but especially if we start talking about dyes in food, and I just wanted to add kind of some scientific research to that. There's been no research that has shown that additives in food, when I'm talking about like red dye number 40, because that's often what I get asked about, worsens behavior. And again, we're talking more about like hyperactivity, but I'm throwing it in there because this is when it comes up. The research is not there. What I will say though is that, similar to what Dr. Doman said, is that having clear and consistent boundaries is what is part of the treatment for ODD and CD. So if we talk about food in that same way, having clear and consistent boundaries about when can you eat, what can you eat, what's healthy, I think will also help to shape the behaviors. And then I just also about physical activity, living in a virtual time, is also scheduling that for your kid is also helpful. Vitamin D deficiency, I know this is a long one to answer, I'm sorry. Is vitamin D deficiency typically presents as fatigue, so as tiredness. It can present as behavioral problems, but I would not anticipate the behavioral problems from vitamin D deficiency to reach the level that they're going to see Dr. Doman or myself. I feel like that child or that adult is going to get picked up by the primary care doctor because they're going to have some other problems involved. So I just want to.
Thank you so much. I appreciate both of your responses to that. In reference to ADHD, we had a question in regards to a child being recently diagnosed with ADHD on the lower end of the spectrum, and this parent would prefer not to have that treated with medicine. Are there any other options for a lower end spectrum of ADHD? And this is just the wording I'm getting from the Q&A.
I know that in the school base, we don't really do with treatment. So I don't really know in that aspect, but I know that there are support within the school to help with children who are experiencing attention difficulty. So again, that is that 504 plan, because in the schoolhouse, we never push medication. Like, that's not what we do. That's not the business we're in. We don't even diagnose. That's not our purpose. Our purpose is to look at those behaviors and see how is it directly impacting the child's academics, and what can we do to help make sure that the child is being successful. So aside from medication, I know that that's the question. I just know that in the school-based resources, that we make sure that we put in accommodations, like what does that look like for that child in order for them to be successful.
I concur. I can say more, but I don't know how many questions we have, and I don't want to take up too much time.
Okay, we have a couple more. We have, the next one is, my 20-year-old daughter is on the autism spectrum. How do I find out what services are available to her for support, like job skills and counseling for her anxiety?
So I love this question. I said that Shree and I are best friends, and we had this conversation years ago about how do you help someone who has special needs, who is now an adult? Because in my opinion, I think that kind of that 17 to 25 age range is really difficult. So how do you know what services? I would first ask yourself, or I would ask you, what services were they receiving in school? So if your daughter was receiving speech, occupational therapy, or even physical therapy, depending upon their deficits, I would definitely get them back involved in those services. They are offered to adults. Typically, they just need a doctor's referral that can come from their adult medicine provider or their psychiatrist or whoever they see most often. The biggest part for me, especially for those people who have autism, is vocational rehab and social skills training. Vocational rehab, again, I live in the state of Texas, but I'm pretty sure Georgia has the same thing. So we have DARS, which is the Department of Assisted Rehabilitative Services. It is a free public service. You just have to reach out to them. And again, DARS is DARS. They do vocational rehab. I have sent patients there who are from 18 to 68. And what they do is they determine what are the person's shortcomings as well as abilities, and then we'll help them to improve on their abilities to then look for work. Um, to be honest, to me, the hardest part is the social skills part, especially for this young adult transitional age. I recommend, again, what services was she receiving in school? And if she did extended school year, meaning like she went until 21, if you still have contact with those students that were in her class, reaching out to them or doing a social support, meaning going to support groups and finding other parents in that situation. I myself, I have probably about 10 kids who are in the same age group with the same diagnoses. And I got them all together a couple of times so that they could meet. And then now they have each other's phone number. So, again, to recap, what services were they receiving before? Speech, occupational, then also social skills training, but really vocational rehab. And I just want to say this, on my soapboxes, helping your child be as independent as they can goes a long way. We all love our kids. I love my daughter. With God's grace and mercy, I'm going to get old and I cannot do it by myself. So, including family, including a network for your special needs child is very important. I'm getting off my.
Thank you, Dr. Rector. Dr. Demond, our next question is for you. What are the ways that you can suggest parents to advocate for their children in situations when the school may label the child? Or how can a parent advocate for their child without their child being labeled in a negative way?
Okay. And so I would say this. Um, I know that schools, it so the whole premise of response to intervention and student support is to make sure that especially our Black and brown boys do not be misdiagnosed in state and federal law to make sure that we do not misdiagnose or misplace children into special education. And so I am very confident that when we do make an eligibility, when we do find a child eligible for special education, that there are plenty of documentation that has shown that does not work. That means that they have not just weeks of documentation. This is months and months and months. Every state has regulations for each special education category. So especially I'm going to speak specifically with emotional behavioral disorder, because I know that specifically for Georgia, we definitely make sure that our children are not being placed in this special education program, and opposed to our other end where they're like, oh, they have autism, it's just autism, instead of our boys being, oh, they just have emotional behavior issues. No. So I would say that just make sure that you have a great support system in the schoolhouse. And especially for school psychologists, I love my position because I don't work specifically for that school. I work for the district, so I'm coming with a clear lens. I'm not coming to help the principal or the school or whatever. I'm helping the child, and I'm helping the parents. So that's my ultimate goal, is to help the child. And so I would definitely say that reach out to those professionals at the school, especially your school psychologists and your intervention specialists, just to make sure that your child is not being misdiagnosed or misplaced in special education.
Thank you so much, Dr. Damon. We have 2 more questions. The next one's going to be for Dr. Rector. Can you discuss or share how sleep plays a role in diagnosing?
Sleep, sleep. I'm laughing because as we're in this pandemic, everyone's sleep schedule is all messed up, and I probably spend most of my time talking about sleep. So let us talk about sleep. So in general, our sleep changes as we get older. Remember, I said it's important to know kids within their normal developmental age, right? So the sleep-wake cycle, super short for a baby. That's why your baby wakes up all the time. And then it extends. And so when I'm talking about an elementary school age child, I'm looking at they should be getting around 10 hours of sleep, okay? I remember when my daughter was a baby and someone said, I'll put my kid to sleep at 7:30. And I was like, really? That seems early. My daughter is 5. My daughter goes to bed at 8. Okay, so 10 hours of sleep. As we get older, adolescents will go to sleep naturally later and then wake up later. But because of our society, we force them to go to bed earlier in the night and then wake up earlier in the morning. That becomes problematic when we start talking about behavioral problems, impulse control, because most teenagers, similar to their adult counterparts, are not getting enough sleep. So when I see people, new patients, follow-up patients, I'm always asking about sleep. Do you have problems falling asleep? Do you have problems staying asleep? Because especially if we're talking about hyperactivity, or if we're talking about an irritable child, I'm talking about like younger child, I'm always interested in what is not only the quantity of their sleep, but the quality of their sleep. And so in order to diagnose anything, in my opinion, you have to understand and be able to know what's happening in that child's life. So something else that I've learned anecdotally is to ask people where they sleep. So, and that's not about socioeconomic status. Met patients who live in huge homes, but they all sleep together. So they're all sleeping in the parent's bed. That affects the child's time of going to sleep, because most of those go to sleep after their children. So your child may be in the bed, but they're not asleep. And so when we start talking about irritability, hyperactivity, if you're not getting good quality and the good quantity of sleep, it will affect all of your behaviors. And someone asked about diet, it will also affect how you eat. You will crave more carbs, more sweets in order to get the energy you lacked from sleep.
Thank you very much, Dr. Rector. Okay, we have one last question in the chat for Dr. Dumond. It says that my child attends private school. However, the school does not offer support services to help my child with his academic needs. What advice would you suggest? I'm really struggling with virtual learning.
Okay. I would definitely suggest that, so we still service private school students. So depending on where your homeschool is at, contact that school. So whatever homeschool near your home, that's either the elementary or middle or high school, reach out to that school, because they still are obligated to help you. They will evaluate your child for your service. It's not to diagnose or anything like that. It's just to use different from outside private psychologicals. We do psychoeducational evaluations where we still use similar or the same measurements that a private psychologist would use. The only difference is that we don't diagnose, and we look at how are the either the emotions, the behavior, or the processing, how well the child is able to process information, and how is that directly impacting the child's academics. So I would definitely say reach out to your home school, send an email, have a phone call, and let them know that you want your child to be evaluated because of your concerns, and then they will definitely make sure that you're being taken care of.
Dr. Doman, is there a particular title or person they should look for to reach out to specifically when they call the school?
Yes, so definitely it's your student support coordinator, either your student support coordinator or your RTI, which is your response to intervention coordinator. You'll definitely have access to my presentation. So definitely is the person or your special ed, either your special ed coordinator. So one of those things, depending where you at, because I know districts have different lingos and such, definitely say that you want your child to be evaluated, and they know exactly who to research or who to contact. And after a week or two, if you do not hear anything, don't hesitate to call back and email them as well.
Thank you. We have a question regarding motivation that maybe either of you could answer. How should parents handle a lack of motivation due to virtual learning assignments being given that provides added stress with all the experiences that students are having to deal with? Should students be punished? What type of parental guidance could you give or share with our participants?
Okay, it's Dr. Rector. All right, virtual school is new to most of us, but I want to say that virtual school is actually not new. It's just there's a lot of homeschool programs that are computer based, so it's just new because most of us are doing it. The way that I think about school punishment, just kind of overall development, is setting a schedule and expectations. So how do I think the first part of the question was isolation. The second part was about kind of parental help. When it comes to isolation, I believe it is important to talk to your kids in a developmentally appropriate way about what are your family's ideas about coronavirus and the pandemic. Now, that probably sounds like, obviously we think it's dangerous, okay? But what does that look like? Does that mean that we're not seeing grandma and grandpa? Does that mean that we just don't go to restaurants? Does that mean that, for the rest of the school year, we're going to do virtual? Does that mean that our bubble will include our neighbors to the right and left of us and our grandparents? And the reason I say that that's important is when talking about isolation is that you have to let your kids know what to expect. I'm an adult and I need to know, like, am I seeing my friends? What does this look like? And I've had to have those conversations with my daughter no, we're not going there. We're not going to the trampoline park because we've talked about there's too many people there. So when it comes to isolation, I would say identify what that looks like in your life, what the pandemic looks like, and be honest with your child about what does that look like. When it comes to parental help and punishment with school, expectations. Virtual school, okay, so I live in the greater Houston area. It's huge. There's probably about, off the top of my head, I could ramble off about 8 school districts. So, and they're all doing it different. I think that you have to talk to your kid about what you expect of them, in the sense of, I have some parents of my patients who they work during the day And so the child does a lot of their work when the parent comes home. They may do online school and synchronous learning during the day, but in the evenings, that's when they really start to do homework. And the parent is okay with it because the child had a break from 2 or 3 in the afternoon until 6. But the child knows that schedule. With any punishment, and this is about anything, you got to tell your kid what to expect. You can't just get mad like, oh, you didn't do your homework, you're not going to play video games. No, it has to be, if you don't have your homework completed for the day by 7 p.m., you're going to lose privileges. And so I would just say being honest, being upfront about expectations and what the punishment will be. And then also, I'm be honest with y'all, being empathic and flexible. Your kid has never done this and you've never done it. So also being empathic and flexible with yourself.
And can I chime in just for a split second? And we add on to what she just said. Also, we need to figure out, why is this child not motivated? Is it because the task is really difficult and it's really hard and they're shutting down and it's like, you know what? This is not something that I can do. So figure out exactly why your child is not motivated. Especially if it's for a specific class or if it's for math or what have you. So definitely be mindful that it may just be hard, and given that they're in a virtual space, they don't have that teacher walking around the classroom to say, okay, Johnny, like let's look at what you just did. They don't have that. So being graceful and being considerate, but also figure out why they're not motivated. There's always a reason.
And I would assume that it would require the parent or guardian to be more engaged with the teachers and the school administrators, in order to know what's happening and to keep up with the work that needs to be done, that may be challenging.
Exactly.
Thank you so very much, both of you, Dr. Rector and Dr. Doman, for answering all of our live questions that we have. I'm going to turn it over to our committee chair, Ms. Sabrina Clark. You're on mute.
Thank you, Nadia. What a phenomenal, informative webinar from Dr. Rector and Dr. Doman. Thank you so very much for spending your evening with us. We really appreciate it. We know that we're just a couple of days before Old St. Nick, and so we do appreciate your time. We appreciate the wealth of knowledge and resources that you shared with us this evening. As Nadia mentioned, I am Sabrina Clark, and I'm the chair of the Physical and Mental Health Committee. And as a committee and as a chapter, we communicate so many times and focus on a lot of how our physical and mental health matters. And tonight, I think, was definitely a reminder that the mental and behavioral health of our youth matter as well. As we all continue in the virtual settings that we're in and maybe feeling a sense of whether it's anxiety, depression, and maybe even isolation, I would certainly, as the doctors indicated, you know what, please solicit assistance, for you and your family, schedule time, with your educators, with their counselor. I think Dr. Doman even mentioned, intervention specialists, and I would say last but not least, possibly even scheduling time with family therapists. To everyone in attendance tonight, so I would say season's greetings from the Atlanta Suburban Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Stay safe and remember, everyone's mental health matters, including our youth. Thank you again for joining us this evening for another edition of Mental Health Mondays. We are live on the third Monday of each month at 6:30, and all of our webinars are recorded and uploaded to our chapter's YouTube channel. And so you can certainly go back and review our recording from last month as well. And with that, we hope to see you again next month. Take it away, Nadia. as Nadia is closing us out, if all of the attendees wouldn't mind, please help us and solicit as we solicit feedback on tonight's topic. You can either scan the QR code that you see there, or you can certainly just click on the link and just take a couple of minutes to provide your input. Have a great evening. Have a great session tonight, ladies. Great job.
Thank you. Thank you for having me.
Thank you, Sash.
You are quite welcome.
You guys did awesome. Thank you so much.
Thank you. Thank you.
You're welcome, Sheree.
I really felt like I could keep on going on, but I had to remember my 15 minutes that I completely went over.
Okay, I think we're done. Are you going to turn off the webinar?
Yes, I am. Good night, everyone. Thank you so much. Happy holidays.
Happy holidays.
That was
Bye.
great.